Hey, Dr. Erickson again. I want to talk to you a little more neurologically right now. There's a part of your brain that you need to realize that you're probably not aware of, that it actually functions or what it does. There's a loop, like a circuit, that should be happening with every process in your body. And that loop is actually the information of your body should pass up into a part of your brain called your cerebellum, right here in the back side of your brain. And then from your cerebellum it crosses over and it goes to what we would call the right brain or the left brain. And then that information is supposed to cycle back down to a part deep inside the brain called the midbrain. And there's a top part of the midbrain and a bottom part of the midbrain. And the bottom part of the midbrain is what receives that information, and it has a controlling effect on the top part of the midbrain. That top part of the midbrain, if you'll think about it as this, it's kind of like a juvenile delinquent, which means that it's always wanting to get into trouble. It's hyperactive. It wants to stimulate things. It wants to check things out. It wants to keep going and going and going. Well, the lower part of the midbrain is actually kind of like the well-intentioned parent. It's supposed to calm things down. It's supposed to get them to relax. It's supposed to get things to function normally and to mediate that. But the problem is if that circuit or that loop that we talked about is affected, if the cerebellum is not firing to the brain or the brain's not firing to the lower part of the midbrain, if the lower part of the midbrain is not able to exert its pressure on the upper part of the midbrain, then what happens is that midbrain or that juvenile delinquent, he has an opportunity to go out and party. And that's not a good thing, because there are certain areas of the brain that control certain types of functions. Let me review a couple of those with you. Look at this slide right here. Decreased output of the brain. So now we're talking about the hemispheres or the right brain or the left brain. If we have decreased output of the brain, we affect the network, and that's the circuit or the loop that I was talking about. So the right brain, if you have problems with the right brain, you may have social anxieties. You may have developmental disorders. Or the nerve sensations to the rest of the body actually reside within that side of the brain. And so you could have sensations of foot pain or arm pain or twitching or itching or whatever elsewhere in the body, and it actually could be coming from the brain itself. Now, in the left brain, if we have a loss of if we have an effect on the left brain, we're going to have a loss of input into the network or that circuit, as I explained to you. Your left brain is your happy brain. So if your left brain's not working right, people will have depression. They'll have anxiety. They'll have this fibrofog, meaning that they can't quite focus like they'd like to. It's like they've got clouds in their brain and they can't quite see through the clear light of day. Also, with the left brain, if it's affected, you may find that you can't express yourself. You may have things on the tip of your tongue that you just can't quite get out. Or people will talk to you and they'll say something to you and you kind of say, huh? You don't quite understand that. That's also tied in with the left brain. Tinnitus, which is ringing in the ear. A lot of people have it. Whether it's buzzing or ringing in the ear, can actually be tied in with a brain problem. Now let's look at the lower brainstem. Okay, this is that midbrain that I was talking about. If we have an effect where the lower part of the brainstem is not receiving its information, it's going to affect the network, the circuit. But also, it can lead to nausea and vomiting. You may just not tolerate things. You may have an uneasy stomach, heart arrhythmias. It's the heart beating inappropriately, too fast, too slow, or missed beats. Breathing problems, asthma, difficulty breathing, catching your breath, TMJ, which is temporal mandibular joint, that's jaw problems, urinary tract infections, because it causes a situation where you can't void, you can't get rid of the urine all the time, and so you have urinary stasis, which allows for infections. IBS, which is irritable bowel syndrome, and also constipation. Let's talk about that upper brainstem now. Perhaps you've heard of the term fight or flight. Okay, fight or flight is actually under control of what's called the sympathetic nervous system. It's your brain's mechanism for helping you deal with stress. Well, this upper brainstem actually has a big component in controlling that. And that's why if it's not being controlled like it's supposed to, you'll always be in a fight or a flight state. Your body's always trying to handle stresses when the stresses may not really be there. This part of the brain is also responsible for the part of the body that's active and alert. And so if this area is firing too high, guess what? You're not going to sleep well at night. And that's not a good situation. So upper brainstem dysfunctions, a couple of other more specific things, chronic pain. So if we're dealing with fibromyalgia, chronic fatigue, if we're dealing with peripheral neuropathies, these are areas that are actually tied in or can be influenced because of an upper brainstem dysfunction, not firing like it's supposed to. Light sensitivity. You go outside and it's just too bright for you. It takes a while for your eyes to accommodate. Insomnia, mentioned that one, not sleeping well. Restless leg syndrome. Those legs just want to dance when you're trying to sleep and relax at night. They can't quite sit still. It can be very disturbing if you're trying to rest. Also migraines. Yep, this area of the brain actually has some influence over the blood vessels that feed back into the brain. And so if we have spasms of those blood vessels, you're going to get migraine or vascular types of headaches, that throbbing, pounding pain. And fibromyalgia is another one that's tied in with this area of the brain. So understand, again, there's a lot more going on here. If you're dealing with a chronic issue or chronic pain, you need to be thoroughly evaluated in order to find out what's going on. And if you've got that problem child or that juvenile delinquent that's not being controlled like it's supposed to, and he's partying all the time, you're going to have symptoms. You're not going to feel good. You're going to have aches and pains. You're not going to sleep well at night. You're not going to handle stress well. You're going to have other metabolic and neurological issues going on as well. We can help that, though. There are specific types of therapies that can be done to help calm down and reestablish that loop or that circuit. But first of all, you have to be properly evaluated to identify where are those problems at. If you want to have that done, give me a call. Let me know how you're doing. Let me know if there's anything that we can do for you. Hope this was helpful to you. Again, there's a lot more going on. That body's a pretty amazing thing, and God bless us with one that's designed to be healthy. And if yours is not, you need to identify what's holding you back so you can actually regain the health that you've lost. It's Dr. Erickson saying have a great day.